America, a nation of opportunity, truly the land of the free and the home of the fat? Never before in the history of the United States have so many citizens been classified as overweight or obese. Over the past 25 years, obesity rates have climbed to a staggering 30% with no signs of slowing. Drastic changes in community life have had a major impact on the health of Americans. When we compare this to a society that is seemingly obsessed with physical appearance, we get, well, a lot of
pressure pushing down on me, pressing down on you. No man has fall under pressure. The ways it feels and down, switch your family into, puts people on streets. Eat it up. This is ourselves under pressure.
When we consider the array of negative physical and emotional health consequences associated with obesity, it is no wonder why health professionals consider obesity to be a national epidemic, one of the most pressing public health concerns of our time. I recently met with Dr. Chris Jankovits, a health science professor at Cal Poly in San Luis Obispo, to gain some professional insight on the childhood obesity epidemic.
Well, the rate of childhood obesity has increased substantially over the past 20 to actually 30 years. One of the most recent Surgeon Generals told us that children who are overweight are much less likely to grow up to be normal weight adults. It's almost to the point where a child who is morbidly obese has a 0% chance of growing up to be a normal weight adult. We know that 8 out of 10 kids who are overweight grow up to be overweight adults as well. So it is a problem that becomes a lifelong trend for many of these children.
The obesity epidemic may seem the problem of a new generation, but it did not spring up overnight. So what's causing American children to be so overweight? That answer is both simple and complex.
The problem of overweight and obesity is the consumption of too many calories. What contributes to the consumption of too many calories is the ready abundance of high-calorie, low-cost, and very convenient food. For the first time ever in the history of mankind, we can get food and plenty of it at any hour of the day in an industrialized society. If I'm hungry right now, I can go out in any direction and get plenty of food at relatively low cost, and I can consume way too much of it very quickly, and the other part of it is it tastes really good.
Adding to the problem is the reduction of physical activity and the increase in sedentary behaviors among young people. Whether they are watching television, playing video games, or using computers, children today are spending much more time indoors. When we factor in community issues such as increased traffic flow, the availability of walkable communities, and the need for green space for recreation, the seemingly simple problem of childhood obesity turns into a complex one. The childhood obesity epidemic is unlike epidemics of the past in that it cannot be cured through an antibiotic or vaccination. Childhood obesity must be tackled in a variety of contexts in order to make a difference, and it will take time and real effort to see a change.
I think probably the most promising solutions are to really look at the total environment, the total way that children live. And families really need to look at the way they're structuring their lives in relation to nutrition, dietary practices, and even physical activity. With our discretionary time, with our downtime, what are we doing with that time? And it means that in our families and in our communities, we have to start rethinking the environment that we've created for ourselves. In the literature, they refer to it now as an obesogenic environment. So if we want to educate people about living in a healthful manner and doing the right things, we also need to create an environment where it's easier to do those things and break down the barriers that allow kids to be more physically active if that's what they want to be, and sometimes even if that's not what they want to be.
Health promotion specialists need to apply the principles of education, empowerment, and guidance to aspects of home, school, and community life. We need to inform and encourage children and parents to eat smarter and be more physically active. We need to ensure our public school systems incorporate health science and physical activity into their standard curriculum. And we need to design communities that facilitate and encourage physical activity and community involvement that is inviting and easy to access. Imagine for a moment you are standing on a riverbank downstream from a bridge when suddenly you see people floating down, flailing in the water and needing to be saved. You have a choice of either jumping into the river and trying to save people as they float by, or venturing upstream to the bridge to find out why people are falling in the water in the first place. The childhood obesity epidemic is a lot like this scenario. We can either focus our efforts on the prevention of this detrimental disease before it begins, or continue to tread water by attempting to treat a problem that is already out of control. A reduction in obesity rates don't just mean improved health status or lowered medical costs. It means improving the very quality of our everyday lives. It means giving hope to the future. It means setting an example for the rest of the world to follow. We cannot let ourselves or our fellow Americans drown in the choppy waters of the obesity epidemic. We need to throw them a life jacket. Indeed, we need to learn to swim.